So, you think your cat might be pregnant? Well, you have definitely come to the right place. It's a wild, super fast journey. But don't you worry, we're going to break it all down for you step by step to make sure everything goes as smoothly as possible.
Okay, let's get right to it. Because honestly, when we're talking about new kittens, being prepared is literally the most important thing. All right, first things first. How do you know for sure she's expecting? I mean, you can't just run out and grab a pregnancy test from the drugstore for your cat. So it really comes down to you. You've got to become a bit of a detective. So these signs don't all just pop up at once. They kind of build up over time. One of the first big clues, usually around week 3, is something called pinking up. You'll notice her nipples get, well, a lot pinker and a little bigger. Then comes the weight game, of course, but you also gotta watch her personality. Your super independent cat might suddenly turn into a Velcro kitty, following you everywhere. Or the total opposite could happen. Your little cuddle bug might suddenly want nothing to do with you. It's all about paying close attention.
You think 9 months is a long time for a pregnancy? A cat pregnancy is like a sprint. We're talking 9 weeks. That's it. It is so fast. So let's look at the week-by-week breakdown of what's happening.
Yeah, you heard that right. Just about 2 months. That's no time at all, which means you have to get everything ready like yesterday. Seriously, it'll sneak up on you if you're not careful.
Okay, so here are the big milestones to watch for. Week 4 is huge. That's when you should probably head to the vet. They can often actually feel the tiny fetuses, and that's also your signal to start switching her over to kitten food. She really needs those extra nutrients. Fast forward to week 7, and her natural instincts just completely take over. You'll probably see her starting to look for a birthing spot, a nesting area. That's her telling you, hey, get my delivery room ready. And speaking of food, let's talk about nutrition for a second. This is non-negotiable. I mean, think about it. She is literally building tiny little lives from scratch inside of her. That takes an incredible amount of energy and exactly the right kind of fuel. It's absolutely crucial. This chart really shows you how things ramp up. So why kitten food? Well, it's basically supercharged food. It's packed with all the extra protein and calories she desperately needs. You'll see, around week 5, her appetite is going to skyrocket. By the end, she might be eating 50% more than she normally does. But here's the trick. Her stomach is getting pretty crowded, right? It's full of kittens, so she can't really eat big meals. The secret is to give her smaller meals, but more often throughout the day. That is the key. Okay, so as that due date gets closer and closer, we need to shift gears a little bit. We've talked about her health. Now let's talk logistics. We need to create the perfect little delivery room for her. This special spot has a name. It's called a queening box or a nesting box. And trust me on this, you want to make one for her, because if you don't, she will find her own spot. And it'll probably be in your clean laundry basket or the back of your favorite closet. So let's get ahead of that and make her a space she'll absolutely love. It makes everything less stressful for everyone involved. And don't worry, this is super easy. A big old cardboard box is perfect. Just find a quiet, warm spot for it. A closet, a spare bathroom, somewhere she won't be bothered. Then you'll want to cut a little doorway for her. Make it low enough so she can get in and out easily, but not so low that the tiny newborn kittens can just wander out on their own. For bedding, start with newspaper on the bottom, that's for any messes, and then put soft, clean blankets or towels right on top. All right, next up, your delivery day toolkit. Think of it kind of like a hospital go bag. You're going to want lots of clean towels and paper towels. Now, Mama Cat usually has things covered, but it's smart to have some sterile scissors and dental floss on hand, just in case, for the umbilical cords. The absolute most important thing, your vet's emergency number, big and bold, right where you can see it. And here's a pro tip. Have a second, smaller, warm box ready. It's a great place to put the new kittens to keep them safe while she's delivering the rest of the litter.
Okay, deep breath. The prep work is done. Now it's all about being on kitten watch. This is where you need to be a super keen observer again, because knowing the signs that labor is starting is going to help you stay calm and ready for what's next.
So in that last day, maybe the last 24 hours, you're going to see a real change in her. She might start pacing, seem really restless, maybe meowing or purring a lot more than usual. She'll be in and out of that nesting box, rearranging the blankets over and over again. And here's a big one. She'll probably stop eating. A cat that suddenly turns her nose up at food, yeah, that's a huge sign that it's almost go time. Now, this is really, really important. Your job right now is basically to do nothing. Seriously, Just be a quiet observer from a distance. Cats are amazing. They've been doing this for thousands of years, and their instincts are incredible. Just being there calmly provides reassurance. Your main role is to be the lookout, just in case something goes wrong. And that brings us to what is, without a doubt, the most critical part of this entire guide. Look, most of the time, everything goes just fine, but you have to know what an emergency looks like. This is the stuff that could save her life and the kitten's lives. The medical term you need to know is dystocia. It basically means a difficult birth. And I need to be crystal clear here. This is not a wait-and-see situation. This is a life-threatening emergency, and it always requires a vet. Okay, everyone, burn this slide into your memory. This is your emergency checklist. If your cat is pushing hard, I mean really straining, for over an hour and no kitten comes out, you call the vet. If you see any kind of dark green discharge before the first kitten arrives, you call the vet. If a kitten is partway out and stuck for more than 10 minutes, or if the mother is clearly in distress, crying out in pain, you call the vet. No hesitation, these are massive red flags, red alerts. Something is very, very wrong. And listen to the experts, like Dr. Pete Wedderburn. There's no gray area here. You don't wait, you don't hope it gets better, you act. Hesitating could be a fatal mistake for both mom and her kittens, and we just don't want that. So let's bring this all together. When you really boil it all down, everything we've talked about comes back to two simple things: being responsible and being prepared. All this stuff, knowing the signs, setting up the box, understanding the timeline, and especially knowing when it's an emergency, that's what being a great cat owner is all about. And it's no exaggeration to say that you being prepared can literally be the difference between a happy story and a heartbreaking one. And going through this whole process really makes you think about the bigger picture. It's an incredible thing to witness, but it also highlights just how much responsibility it all is. And it brings every cat owner to a really important crossroads. Are you truly ready for the massive commitment of a whole litter of kittens? Or does this experience make you realize that maybe it's time to spay your cat to prevent future pregnancies? It's a tough question, but it's one every single responsible pet owner really needs to answer for themselves.